one of my favorite movies of all time is Back to the Future 2. It is one of my favorite because you get to go inside this DeLorean, you get to blast off in the future and see what your future has in store for you. But imagine if you had the ability today to see what the future had in store for you and your health. Well, technology exists to be able to see some of the things that might be lurking within that you might not be hearing about or feeling for the next year or two.
Well, that's a good point, Sean. And Dr. John Pierce joins us right now from Preventative Diagnostic. And that's exactly what you're able to do at the clinic is use this amazing technology to get a look inside people's bodies and see what might be happening in the future.
I just have to say, Sean, I love that analogy. It's a great analogy because we are absolutely able to take a look inside the body at a greater depth than what labs are going to see, a physical exam is going to show. And we're able to get very detailed imaging of all the organs, basically from the neck just below to include the thyroid gland all the way down to the groin to look at prostate in men and uterus and ovaries in women. Wow. We're seeing everything in between there, and we can see abnormalities down to the size of a grain of rice. So if something's askew, we can catch it early. And, in medicine, early diagnosis equals improved prognosis.
Yeah, no doubt. It's your heart, right. Marty. Something's got to be done about your heart. Like this is the chance. So you playing Doc Brown now, you get to tell people, hey, we found something here that might have caused you significant issues in a few years from now. We're going to nip it in the bud early. Tell us about the ailments. You're going from here to down there. I mean, there's a lot you could see.
Right, yeah. Yeah, I mean, well, first off, I got to find a way to grow my hair a little bit more so I can look like that Dr.
Doc Brown, yeah.
We'll get you a wig. Don't worry about it.
Yeah, that'll work, right? So we've actually found some abnormalities in the thyroid, some nodules in the thyroid. We've had to have people go off to get an ultrasound to get a better view of that. We found abnormalities in the lungs, such as lung cancer, and we found some nodules and other things to not be concerned about. We find things to be concerned about. In the heart, we look at the coronary arteries. We can see a calcium score, and that basically tells us if there's plaque buildup in the coronary arteries. And if there's plaque there, then that increases your risk for development of coronary artery, or it is coronary artery disease, excuse me, but it increases your chance of developing a myocardial infarction or a heart attack. And so we've had a handful of patients that we've sent to the cardiologist. They've done some further testing and found that they had 80-90% blockages of those arteries and stented them and, really limited and reduced their risk of a future coronary artery event. We're looking at the liver and the spleen, the kidneys. We found masses in the kidneys. We found stones. So kind of looking into the future, we can see some kidney stones that may pass. And somebody didn't even know that they had a kidney stone. And it's just sitting there waiting to pass. And if you've never had one, and I never have, but working in the emergency room for a few years, that's a very painful process to go through.
My dad had
I've talked to women that said that natural childbirth was less painful than passing a kidney stone.
My dad.
Right?
Oh, boy. I remember when my dad passed his kidney stone. Wow. Yep. Did not know a man's voice could go that high. It was
I've actually seen grown men on all fours, hands and knees, crawling into the emergency room.
Oh, man.
My
diagnosed that kidney stone from across the room, right? So
unreal.
But we've also seen some abnormalities in the bowels, like diverticulitis and things of that nature. We've seen enlarged prostates. We've seen a big tumor in the uterus. We've seen tumors in the ovaries. So we've been able to catch a lot of things that people didn't know that they had, and then we send them on to their primary care or a specialist in that area to take further action. Maybe there's further testing that is needed or a direct intervention. That's not what we do, but we find the problem and let them know that it exists so they can take care of it.
Doctor, I think it's so interesting. So you talk about kidney stones. You talk about, of course, your heart health, which is, one of the biggies for sure. You're also able to detect some cancers. Isn't that correct? Because I know that's one of the things that people fear the most.
Absolutely. We've caught a handful of lung cancers to really, those are the ones that are the most dangerous in my opinion. They're all dangerous, but lung cancer, by the time people present with symptoms to suggest that there might be a problem in the lung, generally that cancer spread throughout the body, and the diagnosis of lung cancer in a lot of cases is terminal. Same thing with the pancreas. So if we can find a tumor in the pancreas early, prognosis is much, much better.
Awesome. I know that the founders
Excellent.
and the owners behind Preventative Diagnostic Center, you guys are really sincere when it comes to having people live longer and healthier lives. Tell us about how you're doing that here in the Valley.
Well, how we're doing is we just have, patients that decide they want to take control of their health and get that peace of mind. They come in and they do this scan, and the scan literally takes about 20 seconds of actual scan time. It's not in a tube, so people that are claustrophobic don't have to fear that. It's kind of like a donut that you just pass through. Your head is never kind of encased in anything. JJ, you've had the scan. You can speak a little bit more on your experience as well. It's very quick and easy. We're getting great detailed images. The machine actually calculates the lowest effective dose of radiation. So you're not being exposed to a standard dose of radiation of like a one size fits all. It looks at the size of the individual and calculates just what they need to give us the best possible image.
Awesome.
Yes, and that was one of the questions I asked because I am concerned about radiation. Doctor, we've run out of time, but we know you have a special offer for folks rather who are interested in coming down and getting this peace of mind with you.
Absolutely. We're offering the heart scan with coronary artery calcium scoring for $125 per couple. Generally, we charge $599 per test.
Wow. Well, it's a great opportunity to take control of your
Amazing.
health. Doctor, it's great having you. Thank you so much for joining us.
Thank you both. Have a great day.
You as well. You want to give them
Thank
a
you,
call,
Dr.
702-534-7900, or go to pdcenterlv.com. As Emmett Brown would say, your future is whatever you make it, so make it a good one. Make it a healthy one. Reach out to Preventative Health
Ooh.
Diagnostic Center. They are a proud sponsor of the Morning Blend.